P.S. What is a pH probe? I think Dr. Prussia went over that, but just to reiterate, the pH probe is a device to measure acidity. It's a thin little wire that's placed in the nose, goes down the esophagus, connected to a device that's electronic in nature. And when acid comes up in the esophagus and it drops the pH, which is a level of acidity, it registers on the probe readout. We can tell when you're having acid come up in the esophagus. That's a pH probe. Okay, let's see. Dr. Wolken, can you tell us a little bit about the complications of laparoscopic surgery? I know you alluded to some of them in the talk, but I believe that this person who asked about it wants some of the more specifics that can be expected as the major problems.
The major problems of laparoscopic Nissen fundoplication, one, of course, is failure of the fundoplication to work, which, as you saw, was very uncommon. The other would be is that the fundoplication can actually, the stitches can break apart, and not only then for sure it won't work because you'll have the reflux again. There have been early reported, during all Nissen fundoplications, it can migrate into the chest. Again, it's very uncommon to happen. Generally speaking, laparoscopic operations carry with it a small percentage of complications related to injury to the adjacent intestines from just the instruments and things like that. Again, it's very uncommon to have that happen. It's been reported that laparoscopic fundoplication probably has fewer complications than open, and the reason for that is that it's believed that you get a better visualization. You can actually, you have the scope and you can put it right up where you're working, as opposed to during an open operation. It's hard to picture, but the area that you're working in is far away from your field of view. It's sort of right underneath your breastbone, and even higher up than that. It's a little more difficult to work if you can picture your hands being in there to try to fix something if you need to. And it's about the same. Sometimes you can nick the liver or the spleen, and again, that's more common in open rather than laparoscopic procedures.
Okay. Also for you, Dr. Wolken, very interesting question, quite simple actually. A patient or an audience member writes, if my GERD is controlled by prescription medication, is the surgical procedure recommended?
Again, that depends. If right now the fundoplication is recommended for patients who their GERD is not controlled, and if they want to get off the medicines. If you don't want to get off the medicines and you feel fine with the medications, there's really no, I mean, you can decide to do whatever you like. I mean, most people would, if they had their choice between taking a pill for the rest of their life and having an operation, just say, given that choice, a lot of people would just decide to take a pill. And I think that's probably where we are today, that if you don't have any problems with taking the medicines and it's not costing you a lot of money, and you don't think it's going to be a problem in the future, and you don't necessarily believe that the theory about reflux and non-acid reflux, then I would say that I think that the conventional wisdom is to keep taking the medicine.
On that note, David, how long does the operation take?
Between 1 and 3 hours.
This is a question here that I believe should be directed to Dr. Prussia. I'd like to know the answer.
Great.
Well, a complete answer. Dr. Prussia, I thought the body needs hydrochloric acid to digest my food. If Prevacid stops the hydrochloric acid from being produced, how do I digest my food? And should I supplement my diet with hydrochloric acid?
No. Acid is a body's defense mechanism for the most part. You know, back when we were cavemen and used to eat food off the ground, we needed to sterilize the food. And acid was a protective measure. And if you look at contents of your small intestine normally, they're sterile. And a sterile environment is better for digestion. So acid, for the most part, was generally used as the stomach's mechanism or the body's mechanism of cleaning the food. I mean, that's obviously a lot less important now because most of what we eat is processed and cleaned for us. But that was the prime role. There is a little bit of role in acid in certain digestion. There's also the role of some role of the cells that make acid in doing other things, like metabolizing alcohol. There is some role. These cells also metabolize alcohol that we ingest. And actually, if you, specifically with the H2 blocker medication, if you suppress acid production using that medication, you may impair alcohol metabolism in the body by up to